is Sarah New. I'm a first-year nursing student at Williston State College, and today I'm going to be demonstrating how to insert a nasogastric tube, as well as how to remove it and how to record your client's intake and output for the day. So we have received orders for Shirley Coast. She's a 54 female, born on 5/14/64. She was admitted at 0800 on 10/14. She was diagnosed with a small bowel obstruction. Her diet is nothing by mouth. We did reveal a bunch of compression and distension in her abdomen via ultrasound at bedside. She has been ordered. She has on here an order for the nurse to insert an NG tube for gastric decompression. On here we have our x-ray of the abdomen after the NGT insertion so that we can verify placement. The doctor also wants her to be on low intermittent suction. Okay, so all of that makes sense. Everything coincides. I don't see a history of allergies or history of taking blood thinners, anticoagulants, facial trauma, anything like that. So we will confirm that with the patient. So I have gathered all of my supplies that I'm going to need for this procedure. We have our disposable pad, we have our Salem Sum, we have our indelible marker, some Kleenex and alcohol for the nose, gloves, lubrication, we have an emesis basin, more tissue, a glass of ice water with a straw, we have our tongue suppressor, a pen light, another marker to mark the tube once it's placed. We have our 60 ml syringe to pull out the gastric contents. We have our medicine cup to place the gastric contents, as well as our litmus paper and our pH chemical chart. So, and then we have our tape and our safety pin to secure the tubing once it's in place. Okay, so now we will go ahead and go to the patient's room with all of our supplies. We are in the patient's room. Hello, Shirley. My name is Nurse. My name is Sarah. I'm going to be your nurse today. Can you give me your name and date of birth, please? Shirley Coast, 5/14/64. Thank you. And let me just look at your armband. Okay, so why I'm here today is the doctor has ordered us to place a tube through your nostril, and it's going to go down into your stomach. It's called an NG tube, and it's going to help decompress your abdomen just to make you feel better. Okay, so are you in any pain today? You are? Okay, can you tell me about that pain? If it's can you rate that pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever? You're at about a 7. Okay, can you tell me where that pain is located? It's in your abdomen, like right here, okay? And can you tell me the quality of that pain? Like, how does it feel? It's kind of bloating and just pressure and nausea, okay. All right, so I'm gonna go ahead and take a listen. I'm gonna go ahead and perform hand hygiene. All right, so I have cleaned my stethoscope with an alcohol prep pad. I'm gonna listen in all 4 quadrants. Okay, so we would normally listen for a little longer than that, but her abdomen is hypoactive bowel sounds, so and that coincides with her diagnosis of a small bowel obstruction, so nothing's moving in there. Okay, so let's explain this procedure a little bit more. What I'm going to have you do is you're going to help me by taking some swallows of water as I'm pressing a tube through your nostril. I'm going to sit you up. And it's going to go down in your stomach, and that's going to help remove the pressure. So we're going to hook the tube up to low intermittent suction, and our canister and pump is in the room. It's ready to go. Okay, do you have any questions about that procedure? Yep, it is a little uncomfortable, and but it is tolerable. So if at any time it becomes completely unbearable, I want you to hold up your hand and tell me to stop. Don't try to speak, but tell me to stop. Okay, and I've also observed her breathing. Her respiratory rate is good. She doesn't have any forced breathing or any history of respiratory trauma. Okay, so let's just get you ready. I'm gonna sit you up really tall, okay? All right. So do you have any history of like a facial trauma to your nose? Have you had any recent nosebleeds? No? Okay, do you take any blood thinners at home? You do not, okay? Do you have a history of any polyps or lesions in there? You don't? Okay. So that sounds good. I'm gonna go ahead and measure to see how long we need to place this tube, okay? All right, so we're gonna measure from the tip of the nose to the lobe, excuse me, while I pull that down one more time, to the xiphoid process. We're going to mark that with our indelible marker. Okay, we're just going to set that aside while we do some other assessments. Okay, Shirley, I want you to go ahead and blow your nose real good for me. Here you go, go ahead and blow your nose. Okay, got it nice and clear, thank you. All right, so we're gonna go ahead and clean off your nose and get any oil, debris, or anything. This is gonna help the adhesive tape stick better so that we hold that tube in place. Thank you. Okay, so I'm just gonna take a look at your nose, your nostrils. Kind of tilt back a little bit for me. All right, so I'm just looking for polyps or lesions, and everything looks good. Is there a particular nostril that seems to work better for you, that is more patent? Your left one, okay, so go ahead and blow out of your left, blow out of your right. Yep, your left one definitely seems more patent, so we're gonna go ahead and use that one. Thank you, ma'am. All right, so now we need to go ahead and lube our tube. You wanna get the first 3 or 4 inches. Water-soluble lubricant. Okay. So we would add this disposable pad. Okay, so do you have any questions for me? You ready to go? Okay, so I'm going to hand you this water. What you're going to do with that is once we get this to the back of your throat, okay, so you're going to gag a little bit, but that's okay, that's good. That means you have a gag reflex. So when that happens, I'm going to pull back a little bit, let you breathe, let you calm down. And then after that, you'll lean forward, you're gonna take a sip of water, and I'm gonna keep progressing with every sip that you take. So that when I say swallow, I want you to take a big swallow, okay? Here's your tissue, in case you feel like you need to wipe your nose, your mouth, and then this is your kidney basin in case you feel like you need to gag, okay? All right, so we're lubed, we're ready to go. All right, so you know what to do, right? You know your hand signals, you know what I'm gonna do, okay? So I'm going to go ahead and place this in on 3. 1, 2, 3. Just gently roll that in. It's going to go in about 3 or 4 inches. Oh, and then she gagged. Don't forget to have your patient's head extended back. Just makes it a lot easier. Okay, so once she gags, you pull it out 1/8 of an inch. Just let her kind of catch your breath. Take a deep breath. Relax. You got your water ready. Okay, so flex your neck forward. I'm going to have you swallow, 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 and swallow. Okay, so we have reached our mark that we met earlier, and just a tiny bit of resistance, so that that would tell me that I am in the stomach. If after 2 or 3 advances and she was still gagging, I would stop and use my tongue blade and my pen light and assess the back of her throat to see if it had coiled in the back of her throat. So, but she tolerated it well, so we knew that it was going where it needed to go. All right, so how's your breathing? How you feeling? Feels okay? All right, good. All right, so let me just go ahead and secure this to you. Getting some stuff ready. Okay, so this just helps secure the tube in place so that it's not pressing against her nostrils anywhere to create any pressure wounds. That looks good. Go ahead and put that tube in place right here so it doesn't move around. Secure that with a safety pin to her gown. All right, so now that that's in, my tube is secure, I need to go ahead and examine the gastric contents so that I know that I'm in the right spot. To do that, I'm going to use a 10. I'm going to go ahead and remove this. I'm going to go ahead and remove that. I placed 10 mils of air in the syringe, and now I'm going to pull out just 10 mils of gastric contents. I'm going to put that in my cup. Go ahead and put my plug back in. Okay, so we'll go ahead and remove all this stuff. That would go in our biohazard bag. So I want to compare the stomach contents. This would also go in our biohazard bag. I want to go ahead and compare the stomach contents, and it is at a 3, so that's good. This will go in the biohazard bag. All right, so all that looks good. Shirley, how are you feeling? Feeling good? Okay, so I'm going to put you back just a little bit, not too much so you don't aspirate. Let's take all this and go ahead and put that pillow back behind your head. All right, so you did good. I'm going to go ahead and document how she tolerated that. I would document the consistency, the color, and the pH of the gastric contents. I would also at this time order an x-ray to confirm the placement before we add anything or hook this up to her pump to the tubing. Okay, so that went well. So we're gonna go ahead and leave the room. And now it's been a couple days and the doctor has ordered Shirley to be taking off the NG tube and the pump. So we have reviewed the orders for that. It's Shirley Coast, 51464. We are not enter the patient's room. Hi Shirley, it's Sarah, your nurse again. Good news, the doctor has ordered for your NG tube to be taken out. Yep, so how are you feeling? How's your stomach feeling? Are you in any pain? No, no pain, that's great. Okay, so I'm gonna go ahead and lay you down just a little bit so I can listen to your stomach. Alright, so I would listen in all 4 quadrants. Okay, so we do have bowel sounds and they are active, so those are good to go. Alright. So basically, Shirley, what we're going to do is I'm going to have you hold your breath, take a deep breath, and then I'm going to pull that NG tube out, okay? Do you understand? Do you have any questions? No? Okay. So I already performed hand hygiene when I walked in the room. I'm going to go ahead and gather my supplies. Put on my gloves. Before we do anything, I need to get that tape off of her nose. To do so, you want to take an alcohol swab and just kind of loosen up around the edges and just remove that tape. Just be gentle. It can be a little bit sticky. Okay, I'm just going to wrap that around the tube because we're going to dispose of that. Just get all the adhesions off. The adhesive off, I mean. Okay, so that's good. All right, are you ready to get this thing out of there? I bet you are. All right, so just add 10 mils of air, kink the tube, add 10 mils of air just to clear any gastric juices. All right, so we'll go ahead and place that in our biohazard bag to be sanitized. Okay, so we're going to just coil this. All right, so on 3, let's sit you up a little bit more. On 3, hold your breath. 1, 2, 3. And we'll pull it out. We'll go ahead and quickly remove that. We have given a client a warm washcloth to clean their face. I'm gonna place this in our biohazard bag. I'm gonna go ahead and remove my gloves. Perform hand hygiene. Give the client a drink of ice cold water to help soothe the throat, as well as help them clean their mouth off of any gastric juices. So, okay, so go ahead and document at this time that it has been taken out, that she tolerated it well. Clean up your work area. Shirley, do you need anything before I go? You got your call light? Okay, so we'll get you some stuff to drink because I know you're thirsty. Okay, we will see you in just a few minutes, okay? And leave the client's room. So after she's had her drink and stuff, so we would want to document on our intake and output record. So we'll just go over here and you can see everything that she's had to drink for the morning. Okay, and that is it. Thank you.